So now we need to talk about the symbol assessment. The purpose of the symbol assessment is to select the type of symbols that are going to meet the current and future needs of the individual. So we talked in the previous slideshows about the hierarchy from easiest to hardest cognitively of the symbols. The easiest to represent would be the real object. The next would be a real photo, followed by a black and white photo, followed by a symbolic photo, like, for example, a board maker symbol. A good way to assess this is start with a functional use format of objects. Give the child a cup and see what they do with it. Give the individual who has a traumatic brain injury or just had a stroke a brush and see if they know to brush their hair. Give them a pencil, see if they start to write with the pencil. Do they know what to do with objects? You can then move on to more of a requesting thing. Have two pictures and say which of a preferred and a non-preferred. For a child, it might be bubbles or a plastic fish or a ball or a sock. Show two pictures and see which one they select. You can use receptive labeling in yes-no formats. You can show 3 pictures of a dog. Which one is a dog? Can they label it? Do they know what that picture is? You can also see if they can match, so an actual orange with a picture of an orange. Now, matching is an easier skill than understanding that the picture represents the object. So if they can match, then move on to picture-object representation, but don't necessarily assume that those two go hand in hand. Matching is an easier skill. So you just want to experiment with different kinds of symbols and see where your individual is. Are they at the point where they still need to be using real objects, or can they begin to use those picture symbols to communicate? You also need to assess their current language. Where are they at in their single word vocabulary? You can use the receptive one word or the Peabody picture vocabulary test to determine these. These are easy tests to give. They're pretty quick. It gives you a general idea of their one-word receptive language skills. You also want to make sure that you're looking at comprehension of action words. You can say, you want to look at, do they know jump and run and whatnot? Do they have words for absent people? Do they know who sister is if sister's not in the room? And the same goes for objects and relational words. You also want to look and see if they have some of those common language structures. Do they understand plurals? Do they understand past tense? Do they understand ing? Things like that. You're going to want to come up with some assessment strategies to help you figure those things out, whether they be norm referenced or criterion referenced. It's also very, very, very important to always assess literacy skills when completing an AAC evaluation. So I cannot tell you how many times people assume that individuals who are nonverbal can't read, and that is not always the case. I had a 7th grade student who they were using picture writing with, and I asked what his reading level was at, and they had no idea, and I gave him a book and then asked him comprehension questions about it, and sure enough, he could read. People just assumed that he couldn't. I mean, he answered the comprehension questions on his device that he already had. But people just assume that individuals who are nonverbal can't read, and that is not always the case. Show a student 3 letters, a C, an O, and a G, and say which one says or which one says k, k, k. Can the individual point to the letter that makes that sound? Do they have phonological awareness? Can they, do they understand, a letter C is a C, things like that. Make sure you're always assessing that. Always also look at spelling assessment. Show them a picture of a dog, give them some magnetic letter tiles. Can you spell the word dog? See if they can. If not, then say, what's the first sound we hear in the word dog? D, d, d. Which letter makes that sound? Can they find the letter D? Also look at their recognition spelling, especially a student in the school system, if their classmates have been learning sight words. Put 3 sight words on an easel and say which one says it. Can they figure it out? Do they know those sight words, things that they've seen a lot? Do they recognize their name? If you give them in a field of 3 or 4 different names, do they know which one is theirs, type of thing for the recognition spelling. I will say when you're doing this, make sure that you present 3 items instead of 2 items, because with 2 items, it's still kind of a 50-50. You don't really know whether or not they truly know the skill. They might just be great guessers. But if you increase the set size to 3 or 4, then it gives you a little bit more accurate information of whether or not they truly know it or they're just guessing. if they're doing really well in a set of 3, then increase it to a set of 6 to see if they can still give you the correct answer or if that's too overwhelming. If you're using a set of 6 and that's too hard, then scale it back down to 4 and whatnot. So think about the set size of options that you're presenting to them. You want to think about their vision abilities. Again, this isn't really something you should be assessing by yourself. This is something you should be working with a vision specialist on. So I'll let you go ahead and read through that. There's more detailed information in your book about the vision system. Hearing assessment. So important to go back and look at if the individual has had a hearing screening done or a hearing test done. So many times other professionals forget to look at the hearing component of it, when I can't even tell you how many times I've come across a child who has failed 6 hearing screenings but never went and got a full evaluation, finally did, and then there was a hearing loss there. So make sure you're always checking their hearing history and recommending to get that checked out. These are just some different assessments that you might use. Communication Matrix, I think, is a wonderful resource. You can, I will go to www.communicationmatrix.com, and it is a free system that it's like a matrix, essentially, that has the different communication levels on it. So it starts with pre-symbolic, pre-intentional behaviors and works its way down the hierarchy. It's a communication matrix that you have the parents fill out, you have somebody that's familiar with the student or the adult fill out, and then you fill out too. And it's color-coded, so blue means it's a skill that they've mastered, yellow means it's a skill that's emerging, and white means it's a skill they have not yet used. It's also a good one to use if you are trying to figure out what kind of criterion referenced assessments you need to do and what kind of skills do you need to be looking for. Pull out that communication matrix. It gives you the hierarchy, the 7 levels of communication skills on there, and so you can say, oh, I need to see if my kiddo or my adult knows how to do this skill or knows how to do this skill, and then you can come up with an activity to assess that skill. The communication matrix will be very helpful for you in your beginning assessment days of figuring out what you need to be looking for if you're kind of at a loss for that. So I highly recommend that resource. Again, it's free and it's online. It's really a good one. The WADI is the Wisconsin Assistive Technology Index. It's a more formalized test that you may come across if you're working in a school district or a hospital or whatnot. It's an okay one. I don't use it all the time, but it's out there. There are several charts in your book that you can look at. There's a lot of online tools. So the SWAC website, like I mentioned earlier, it's www.swac.com, and that is a Colorado website. It's for the assistive technology program in the schools in the state of Colorado. Every state has their own version of that. In Colorado, it's just called SWAC. But even if you're not in Colorado, if you go to that website and then on the far right hand side there's a tab that's a drop down menu that says resources. If you click on that, and then there's like an assessments tab and a intervention tab and whatnot, click on those. There are all kinds of forms on that website that are free for you to use. It's basically just all of the school professionals in the state have developed all of these forms and whatnot and put them on this website for other professionals to use. It's kind of a sharing place. Because in the field of AAC, there's not a whole lot of research at this point because things change so fast, and so people are really good about working together. So look at the resources tab on that SWAC website if you're at a loss of what to do as well. That has a lot of great resources. BVSD stands for Boulder Valley School District. If you Google BVSD AAC or SWAC, BVSD SWAC, they have a lot of really great resources on their website as well. Boulder Valley School District has a phenomenal AAC program in their district. So I encourage you to Google that and check out all of the different resources on their website as well. The source for AAC is a textbook that I recommend and I think can be helpful. So Google that and look into that textbook as well. You can buy the online CD version of it for I think like $25 or $30, and it's pretty helpful. So those are just some resources I encourage you to look into. So now we're into Chapter 7. A lot of this gets kind of repetitive, so I'm going to go ahead and just fly through this. The policy barriers, some of those are listed. There's practice barriers. You can look in your book for that. Knowledge barriers that we talked about earlier, those are best remediated through educational efforts. You need to teach other individuals how to work with the device so that people aren't afraid of it. Again, same thing with skill barriers and attitude barriers. You need to teach other individuals about AAC so that they know how to work with the individual and they're not afraid of it. It can be an awkward situation for people who aren't comfortable with AAC. Plan and implement interventions for today and tomorrow. Use evidence-based practice. I'm sure that's the first time you've heard that in your program, of course. Today, decisions need to think about what does the person need immediately? What do they need to be able to communicate right now? Tomorrow, decisions are based on the projection of their future. There's 3 components. You want to increase their natural ability. You want to utilize their environment and the adaptations that they need. And you want to incorporate the AAC strategies and techniques. Again, follow-up, follow-up, follow-up. Follow-up is so important. Make sure you're checking in consistently. After I do an AAC evaluation, I go into my calendar and I set a reminder to email the SLP and the family every 2 weeks and check in and just ask how things are going and if they need anything else. It's also really important to try to do your intervention, your therapy, in a natural context. We say that that's true for most language interventions in the field of speech-language pathology, but it's especially important for AAC. Do your therapy in the community, in the home, in the school classroom, at sporting events, because for your individual to see how the device can work and how powerful it can be in the moment is how you're going to get their buy-in. Measure and evaluate your outcomes just like you would in any other field of speech-language pathology. You need to be continuously monitoring and saying, is this working? Is this working? And if it's not, then go back to the drawing board. A lot of times AAC is kind of a trial and error field. You don't know if something's going to work until you give it a try. Try a system with an individual. If it's too hard, if it's too easy, if it's not quick enough, if it's not giving them the vocabulary that they need, then go back to the drawing board. Make sure you're always evaluating where you're at and what you can be doing better or differently to help your individual. And make sure that you're communicating with the rest of the team, with the parents, with the individual themselves about how things are going. Again, I've already harped on this quite a bit, but follow-up is important. Technology changes, you need to be concerned about maturational changes as well. If you're working with a 6-year-old girl when you start working with her, and you've been working with her for several years, all of a sudden she's 12, 13, 14, make sure that you have information that you're talking to her about her period or working with her family to talk about things like that and make sure that vocabulary is in there and whatnot. Think about how the person is maturing and changing and what that means for the type of vocabulary they need. Technology changes, you got to keep up with that with the best you can. It can be difficult, but you're just going to have to do your best. So at the end of my presentations, I try to do an AAC toolbox, so give you some ideas if you're working with people who use AAC right now. So one of my ideas is activities in a bag. So you can bring all of the supplies or games that you're going to be using for that session in a closed bag that's not see-through, like a canvas type bag. And then you need to teach your client the vocabulary that they need, whether they're using a high-tech device or a mid-tech device or sign language or whatever they may be using. Give them the vocabulary that they need to open the bag. Have them say, I want to see, or open please, or any of those kind of vocabulary words that are appropriate. And then once they ask you to open it, you open the bag, pull out all of the toys, put them in a line and then let them choose the order of what they want to do. This works on requesting, commenting, information sharing, asking questions, etc. Simon Says is a fun one. Kids tend to love that. The kid with the device gets to be Simon, and they get to tell you what to do or tell others what to do. Repetitive books are also fabulous for working with AAC. Brown bear, what do you see? Have your student get into their device and say, I see a blue monkey, or whatever the next page is going to be. 8 Little Monkeys, Hungry Caterpillar, all of those repetitive books are great for teaching vocabulary in the device and helping your student navigate through where that vocabulary is. All right, well, that was the end of our assessment slideshow. If you have any questions, please feel free to email me or post on the discussion board. Thank you very much and have a good day.